All right, for our next topic, we have two speakers, and the topic is benefits of cardiac rehab. And we have Peggy Ward and Miranda Ripplinger joining us. Are you both in the crowd? Oh, perfect. So I'll read your bios then, starting with Peggy. Peggy Ward is a registered nurse in cardiac rehab at Essentia Health, Heart, and Vascular Center. She completed her RN degree at Jamestown College. She worked in the critical care unit for 27 years and now works in the cardiac rehab program. Peggy works to help solve patients' issues and concerns while in cardiac rehab. And Miranda. So Miranda Ripplinger. Miranda is a cardiac rehab specialist at Essentia Health, Heart, and Vascular Center. She received her undergraduate degree in exercise science at NDSU and her Master of Science degree in exercise nutrition science. Miranda is also a certified personal trainer and diabetes prevention specialist. Okay, so Peggy and Miranda, take it away.
All right, thank you. Do we have the clicker? That's yours. All right, well, I am Miranda, and I am also a clinical exercise physiologist in cardiac rehab. And then, of course, this is Peggy. So today we are going to go over a variety of topics, but the first thing, of course, is explaining what cardiac rehab is. We will talk a little bit about our program at Essentia Health, our significant statistics that we have, some important things that we'd like to talk about and point out, benefits of both cardiac rehab and exercise in general, and then we'll have time at the end for questions. So, right off the bat, what is cardiac rehab? It is a medically supervised program for individuals or patients that have cardiovascular disease. It is important that a referral is required from an MD, a physician, a DO. However, a PA and NP can initiate that referral, or like a nurse practitioner that we have. There are also 4 phases of cardiac rehab. So they're simply called phase 1, 2, 3, and 4. Nothing too special about them. So phase 1 here is inpatient. That is in the hospital. You are still currently admitted and you just had a heart attack, a procedure like a stent, or had an open heart surgery. During that time, we will go and visit you. We will get you up and moving. We really want to focus on that mobility and really just being comfortable moving after having this procedure, this major life event that just happened. We'll also talk more about what cardiac rehab is and what the program all entails, so that once you are discharged from the hospital, you have an idea of what you're kind of walking into after that. So that brings me to phase 2. That is our monitored outpatient program. And so this is when patients are outside of the hospital, they are at home for a period of time, and then they will come to our program or wherever they are, whichever program they choose, and they will come ideally for 3 times a week for a total of 36 sessions, so roughly 3 months' time. Here, they will be hooked up or have a portable telemetry system on them, which monitors their heart rhythm during exercise. We make sure that there's nothing abnormal going on, make sure that no new signs or symptoms arise during this time. We also will keep a close eye on blood pressures during this time, both pre-exercise, post-exercise, and at least once during exercise for every session to make sure everything's looking okay. We also go over a lot of information on education and goal setting, which is very important and something we will touch on a little bit more later. Next up is our phase 3, and this is non-monitored outpatient. So this is less one-on-one interaction. You have a little bit more freedom, but you still come and attend our program or our outpatient clinic. During this time, you're going to be focusing more on maintaining your new habits, your new goals, your new lifestyle as you learn to live with it. And you continue to reach for those goals or create new ones. Maybe you've already achieved these other goals. And so this is a time where you're kind of figuring stuff out more on your own, but we're still there to help guide you, answer questions, things like that. And then last but not least here, we have phase 4. And this is on your own completely. So you're either doing it at home, you're exercising there, or maybe you're going to your local gym or some other form of exercise that you prefer doing. That means that there's no medical supervision during this time. You're kind of comfortable, feel good, feel confident in your ability to monitor yourself, your own signs and symptoms, maybe even take your own blood pressure with your own machine at home. So that's a really quick overview of what cardiac rehab is. And so Peggy's gonna go a little bit deeper into our specific program at Essentia Health, what we do and who is on our team.
Sure. So our program, we have phase 1, phase 2, and phase 3. And as Miranda discussed, we see our phase 1 patients inpatient. We see them Monday through Friday, depending on our patient list. It can be anywhere from 2, I think we've had up to 17 people on our list in one day. So we see those patients. Sometimes we make a referral to an outside facility, whether it's somewhere in Minnesota, rural North Dakota, closer to home, so we can make sure that they can continue on with their cardiac rehab. Phase 2 is our monitored patients, like Miranda talked about. And then phase 3 are non-monitored patients. So our phase 2 and phase 3 patients, we see them on Monday, Wednesdays, and Fridays. They exercise together. The phase 2 do wear a heart monitor, so we're monitoring, watching their heart rhythm. I kind of tell patients, make sure it's behaving itself, and we don't see anything alarming. We do check their blood pressure. And the phase 3 patients also come, they get a blood pressure check at the beginning and at the end. We recently moved to a new facility in December. So this is kind of a glimpse of what cardiac rehab looks like. We have a series of treadmills, new step machines, and arm bikes, ellipticals, rowing machines, free weights. A lot of our patients come to us not just with a heart condition, either mobility, joint problems, lack of physical exercise. So we really try to individualize it, meet them where they're at and what they're comfortable with exercising. Recently I've used the little line, I'm not training you for the Olympics, but we're getting you ready to get back to being physically active. And a lot of our patients do feel safe there because they know someone's watching their heart and they feel comfortable. Our team, we do have a provider oversight. We currently have 2 clinical exercise physiologists who are in our program, 2 registered nurses. We have a couple registered nurses that also help us out as needed. And then students and interns come to our program. We have exercise science students, nursing students, dietary students, spend a little time with our program and learn what cardiac rehab is about. We do collaborate, both for our phase 2 and phase 3 patients. We make sure that if there are questions, either need to be followed up with a provider, congestive heart failure nurses, we work very closely with them. We monitor their weight and symptom management. And also tobacco referral would be another thing that we do here too if smoking cessation is something that that patient needs. We collaborate with our respiratory therapy department and get them involved in smoking cessation. A big part of our program is education. So we have the different topics listed that we go over, obviously discussing their risk factors, which helps us to individualize their education and kind of key into those key concepts that are troubling them or things that they have to focus in on. I would say a great majority has to do with nutrition. Of course, we promote the fruits, the vegetables, the sodium, watching your salt content, choosing the leaner proteins, etc. And lifestyle modification. For some people, understanding a serving size, looking at a food label, understanding that concept of kind of almost being a food detective and understanding the impact that nutrition plays in our heart health. Surprisingly, and maybe not, medications. Several times we'll hear, oh, I have a family member that takes care of my medications. I don't really know what I take. I just take them. So we focus in on that, making sure they understand the indications, why they're taking them, the importance of them, side effects, things to follow up on. And of course, exercise, which is why they're there. We follow the guidelines by the American Heart Association for 150 minutes in a week. Again, reminding them that's basically the minimum. We want to build up onto that, but we focus in on getting that 150 minutes per week. And like I said, a lot of it is just that lifestyle modification and kind of developing new routines, new habits, etc. And also, I think a key part to our program is the stress and emotional health and the impact that plays on our heart health. And sometimes people aren't so willing to accept that or understand that, but we know it does make a big difference. Their emotional health and how they handle stress can play into their heart health. So finding coping mechanisms, ways that they can handle their stress in a positive fashion. And of course, exercise is one of those great things that helps with stress reduction. So promoting that. And once we go through their education, understand their risk factors, we work on goal setting with them. So their overall goals, again, focusing in on their nutrition, whether they have high blood pressure and we need to really concentrate on their salt content or what is contributing to their high blood pressure or their weight gain for that day. What did you eat yesterday? You know, did you have a saltier meal? Is there, you know, what contributed to that? Are you drinking your water? And making sure that they're getting that. We promote water quite a bit. Drink your water. And then, of course, exercise, setting those goals for exercise. And like I said earlier, not all of our patients are able to walk on the treadmill, or they're uncomfortable walking on the treadmill, or maybe it's a balance, a fall risk concern that they have. But we have other pieces of equipment where they can still get their exercise in and feel like they're making progress that way. And I would say psychosocial is a huge part of it. They almost are their own little support group because all of our patients in that room have something in common. They have heart disease. And so they can kind of make those connections, and you see strangers become friends, and they make plans to get together for lunch. And we actually have a group that after they exercise in the morning, they go downstairs and have coffee. So they've kind of developed their own little unique friendships and their own little support group to help each other through their heart disease. So it's kind of fun to see those relationships build and see the connections happen. Our program, we kind of grabbed just some of the data from our program from April 2020 through March of 2021. And just a reminder, we were in the midst of COVID during this time too. So, but that's kind of a rundown of the different patient populations that we saw. So PCIs, MIs and PCIs, CABGs, the valves, aneurysm repairs, transplants. These are all the listed indications for cardiac rehab. Since that data, we actually have seen an increase in our PAD and PVD populations. So working with them, SCAD, we've had a couple patients with that. POTS is actually a phase 3 requirement, falls in that category. And we are seeing actually a large increase in our POTS population. So, and then congestive heart failure also is part of our patient population. And then again, just some of the data and the demographics from our program during that time period. Again, more men than women. And then we do strive to get them into cardiac rehab about a week after they've had their stent placed, and then around that 3 to 4 week mark after they've had heart surgery. During this time, our average attendance was about 20 sessions out of 36. Most insurance companies will cover their phase 2 program, so they get insurance coverage with that up to 36 sessions. So when I look back at this one, I think COVID did kind of play a role in that 20 out of 36 sessions. We were limited with how many people we could have at one time in our space, and honestly, some of our patients just weren't comfortable coming there and exercising. So we tried to check in with them on the telephone and make sure that they were doing their exercises at home. It did create a lot of challenges and some unique things that we were doing just to keep them going. But I should say phase 2 is covered most of the time by insurance. And then phase 3, cardiac rehab, patients typically will pay out of pocket for that program. And then this is just a relationship of cardiac rehab sessions and the prevalence of death or MIs according to the number of sessions that an individual would attend. So obviously attending more sessions of cardiac rehab is going to give you improved outcomes. Miranda's gonna kind of wind it up here and talk about some of the benefits.
So, of course, there's benefits to overall health when it comes to exercise. And so just a few to mention here. Have you go to the next slide, please?
Thank you.
Thank you. Cardiovascular, of course, everything that we've been talking about. That is going to be a huge, huge benefit that we see with exercise in general, not just cardiac rehab, right? Every single person can benefit from cardiovascular or from exercise. Strength, you're going to build strength. And with that, you're probably going to build balance as well, or improve that balance. Research has shown that as you grow older, you become, you lose your strength, your muscular strength, but also a lot of that balance. Once you don't have that balance, you tend to fall more, then you're in the hospital and maybe other things occur, right? And so focusing on that balance, and then of course, again, that psychosocial. Exercise is a great remedy for mental health or those psychosocial aspects of life. And so really just great benefits to overall health as a whole. Now, there are other benefits, more specific benefits from exercise. And so, again, that psychosocial, that decreased anxiety and depression, improved cognitive function. Again, that balance, you have reduced risk of falls and injuries, which will help mitigate functional limitations later on. So it's going to help you be more active longer, continue doing your activities of daily living, things like that. It's also just an effective therapy for many chronic diseases, not just cardiovascular disease. And this is taken straight from the American College of Sports Medicine, which is the governing body revolving around exercise, science, and disease. Now, more specifically for risk factors for those, or the risk factors for cardiovascular disease, such as physical inactivity, hypertension, or high blood pressure, hyperlipidemia, or like those high cholesterol levels, things like that, diabetes and obesity. Now, these are not all the risk factors that you can have for cardiovascular disease, but they're the most common. And with exercise, you can improve all of these. So as far as hypertension goes, you can reduce that systolic and diastolic pressure by 10 to 15 millimeters of mercury just from exercise. You can increase your HDL or your good cholesterol and decrease your triglycerides and your LDL or your bad cholesterol values. That means we have a less chance of another or more plaque buildup in our arteries, which we've been hearing this entire time from our physicians, right? Diabetes, we can reduce our insulin needs and improve glucose intolerance. We can save money, right? Insulin is not cheap, so the more we can save money, the better. And then last but not least, obesity. So, of course, exercise is going to burn calories, which can reduce your total body fat in your intra-abdominal adipose tissue, or that fat tissue within your abdominal area. And then lastly, our cardiac rehab program, or cardiac rehab program in general, these are all things that exercise is good for, right? We have that improved quality of life, that increased knowledge of disease process and prevention strategies. So through education that we provide patients, they're going to have this increased knowledge. Maybe they're going to have improved medication compliance as well. They actually know what they're taking now and why they're taking it, when they're taking it, things like that. So they're probably more likely to actually do it in the first place. That improved metabolic profile. And then, of course, decreased cost of office visits and hospitalizations. They're not going to the ER as often. They have that better health overall. And so For our program specifically, we pulled together just a few of our screening tools that we use and looked at the pre versus post and the change that we see with them. So this is from the same time frame as earlier, from April of 2020 to March of 2021, so again during COVID. And so going down the list here from left, or down the list on the left, Rate Your Plate. That is a nutrition screening tool that we have. It measures your the food choices you make and how well you make them. So the higher the score, the better. And so we saw individuals, initially they scored 61 on that, and after their visits, after their 36 sessions or however many sessions they completed for their phase 2, they had a 5% increase in their score up to a 64, which means that they are making these nutritional changes, which is going to help them in the long run. The Dartmouth COOP, that is a quality of life score. So looking at how they are psychosocially, the lower the score, the better. So we saw a 17% reduction in that. The PHQ-9 is a psychosocial or depression and anxiety scoring, and we saw a 46% reduction in that score, which is amazing to see. Tobacco use, we saw a reduction of 16% in people that were using tobacco at the beginning versus the end of their phase 2 sessions. And then lastly, their BMI. The BMI also decreased, not quite as much as the others, but still saw a decrease nonetheless. But I believe more importantly, we are seeing these other changes in other aspects of life as well that I definitely think need to continue to improve over time. So last thing now, we'll just open it up to questions. If anybody has any, we'll answer them to the best of our ability.
I'm going to just hop right on here. I'm Amy Johnson. We started this, and cardiac rehab was one of those topics I really wanted covered. After Pete's surgery, he's up at the airport picking up some of our friends who were supposed to be here at 10 o'clock this morning. They just landed. And he says the cardiac rehab nurses saved his life because he was, about a month or so after surgery, he went in for his orientation, and he says, yeah, I kind of get a little short of breath when I lay down, so I've been sleeping in my recliner. Well, you're looking a little pale, and that shouldn't be happening. So they got him immediately upstairs to see a cardiologist, and he was carrying a little extra fluid. They probably saved him from having to be drained. They just got him on a little bit more Lasix that cleared that up. They also told him he was anemic, and they told him he'd go ahead and eat some hamburgers to get your iron up. That was probably the best thing he heard. He's like, all right, hamburgers once a week now. Lean hamburgers. But we see a lot in the online forums when we look at what kind of topics we want to cover, and there's a lot of confusion on what cardiac rehab is. We constantly hear, well, I can walk on a treadmill by myself. I was active before, why would I need to go and be watched? I'll just go start running. I know from Pete's experience, what he got, as much as he didn't want to get up and go, the first time he went, he had to take 2 breaks getting from the door to the cardiac rehab. By the 4th session, he could make it all the way. But when he was on the treadmill being monitored, he said that confidence that I felt, knowing that how hard can I really push? Because it's real easy to dial it back. And he goes, sometimes you got to man up and do the right thing. But how do you address when you see people who truly don't understand? You see people putting off cardiac rehab until 3 months after surgery, especially with the valve replacement. And, Pete went in at 4 weeks and they caught some things. So first would be, what would be that recommended time? How soon should somebody get in? I know there was one slide on it. Or is there a longer time? And also, how do we answer those questions when people out there ask us, why do I need cardiac rehab? I know how to walk and I used to run.
Great questions. So going back to the first question that you had for how long or what is a time frame that we should get these people into rehab. So for individuals that have like a stent placement, things like that, minimally invasive, we want them in within that first week. So we will contact them. We talk to them inpatient-wise, or phase 1 cardiac rehab, and then we will contact them a few days later, and we'll say, all right, how are you feeling? How's adjustment coming, being at home? All right, when can you start? Next week. You know, what is a good time for you? So we want them in as soon as possible. There's a lot of research out there that says the sooner, the better, especially for those individuals that had a minimally invasive surgery or procedure. For those like open heart surgeries, for cabbages or bypass surgeries, we usually wait that 3 to 4 weeks because those individuals have a little bit of healing that they need to get done before they can come and exercise. They had a major procedure, and we do not want to push it yet. And so we give them time to adjust and get used to it prior to them coming in, just to, I guess, help them be adjusted, but also they have limitations when it comes to upper body ability. They cannot lift heavy things. They cannot do things that they normally would do. Cannot drive, you know, do all those things. So it's a little bit tougher for them as well. And so that's when we shoot for that 3 to 4 week mark for those individuals. Do you have anything to add for that?
Well, we do send home our post-op surgical patients with a walking program because walking really is the best form of exercise. And so when I say, you know, we're going to see you in about 3 to 4 weeks once after your heart surgery, but that doesn't mean you go home and sit on the couch, okay? Walking is the best form of exercise. It's going to help your lungs, it's going to help your brain, it's going to increase your appetite. You're just going to feel better. And so we do have a walking program where they slowly start to increase their endurance and their stamina and increase their ability to do their activities of daily living. Going back to the comment you had made about your husband, part of what I explained to them is your heart is a muscle. And if we don't exercise it, it's going to get weaker. Just like our arms and our legs. If we don't use those muscles, they get weaker over time. So our focus in cardiac rehab is to strengthen that heart muscle and make it a more effective pump. We do have, you know, some people that think, oh, cardiac rehab, that's for old people. It's not for me. The old people go there. But, you know, honestly, we see people all ages. Heart disease does not discriminate, as we all know, but we have 18-year-olds all the way up to, I think, 92 is our oldest person. And unfortunately, we're seeing younger patients, but so it doesn't discriminate. But as far as our post-op heart patients, one of the most rewarding parts for me, and especially coming from a critical care background, where I took care of the patients in the hospital and watched them those first 5 to 7 days in the hospital, and then I sent them home and wondered, I wonder how they're doing. It is such a delight to see them come in on that very first day, and some of them don't even get on the treadmill, you know, until about the 10th session. Some of them are a little bit more eager, or they're using a walker or a cane, and by their 36th visit, they're kicking butt on the treadmill. I mean, and you have to remind them of that. Just think how far you've come in the past 3 months. You really have made an outstanding improvement. So those things are very rewarding, and I kind of try to remind our patients about that along the way. Everybody starts at a certain point, and we just build from where they're at and help them get stronger.
Any other questions?
Well, thank you guys so much. This has been quite an adventure. Nothing like North Dakota in February, right? But hey, who decided to heart